Hospitals are designed to heal us, right? But without strict rules in place, their byproducts can actually be incredibly dangerous. Today, in this explainer, we're exploring Nepal's blueprint for stopping that hidden threat. We're looking at their 2020 National Healthcare Waste Management Standards and Operating Procedures. It's a comprehensive, meticulously detailed guide that tackles a massive, often completely overlooked global issue.
Our agenda for this explainer covers the hidden cost of healing, decoding healthcare waste, the 6 steps to safety, the color code defense, safe destruction and disposal, and finally, our duty of care.
Let's jump right into Section 1, the hidden cost of healing. So think about it. When a hospital heals a patient, what actually happens to all its hazardous waste? It's kind of a mystery most of us never think about, is it? We often treat trash bins like magical portals to a place called away. We get our treatment, we leave feeling better, and we just assume the waste vanishes. But obviously, it doesn't. If it's not handled correctly, that waste enters our soil, it enters our water, and it ends up in the hands of vulnerable workers.
Look at this number, 66%. In a recent study out of Nepal, a staggering 66% of informal waste workers reported being injured on the job in just the past 12 months. The research highlighted in this document involved nearly 1,300 informal waste workers in the Kathmandu Valley and Nuwako, and a majority had suffered cuts and injuries. And worse still, 68% of them weren't using any personal protective equipment, exposing them to incredibly high risks of infectious diseases.
And this isn't just a local issue. Those local injuries connect to a massive global crisis. The World Health Organization estimates that over 20 million infections, things like hepatitis B, hepatitis C, and HIV, occur every single year due to unsafe injection practices globally. To put that into perspective locally, in Nepal alone, a single hospital bed generates around 0.99 to 1.73 kilograms of waste every single day. The cumulative risk there is just staggering.
Moving on to Section 2, decoding healthcare waste.
Now, what's really interesting here is that the vast majority of hospital waste, typically between 75 and 90%, averaging at around 85%, is literally just harmless household trash. We're talking biodegradable food scraps, paper, standard packaging. The real danger is just that tiny 15% slice you see. But here's the catch. If you mix them, you've just turned your entire waste output into a hazard.
We can actually break down that dangerous 15% slice even further into these highly specific threats. They range from infectious tissues and human organs to radioactive materials and expired pharmaceuticals. Take cytotoxic waste, for example. That includes materials used in chemotherapy that can literally stop cell growth. It's incredibly helpful for fighting cancer, sure, but incredibly dangerous if it leaks into the groundwater. E-waste is also a growing concern as modern medicine relies more and more on complex electronic diagnostic tools.
All right, Section 3, the 6 steps to safety.
Now that we know the threat, this document lays out a brilliant, comprehensive 6-step life cycle that follows a single piece of medical waste from its creation to its ultimate safe destruction. It begins with minimization, basically just generating less waste by adopting sustainable behaviors like choosing reusable equipment where it's safe to do so. From there, it moves through segregation at the source, careful collection, secure transportation, scientifically backed treatment, and constant monitoring. The thing is, proper waste management at every single one of those checkpoints is absolutely essential to halt the spread of nosocomial or hospital-acquired infections and toxic pollution. If any one of these checkpoints fails, the surrounding environment and the local community immediately bear the toxic burden. A failure in transportation means a spill in a public hallway. A failure in storage means scavengers or animals might access hazardous materials. The chain of safety literally must remain unbroken.
Which brings us to Section 4, the color code defense.
This is where bureaucratic policy turns into intuitive survival through strict color coding. Red is the universal warning for highly hazardous materials, so that's for infectious waste and sharps. Green is for your harmless biodegradable waste, while blue handles standard non-biodegradable recyclables. Yellow takes on the toxic chemicals and cytotoxic drugs, and black is strictly reserved for radioactive materials.
To hit the nail on the head, the document states, segregation of the wasted source is the most important step for a successful management of healthcare waste. Why? Well, if you toss an infectious needle into the general blue bin, you have instantly contaminated everything in it. That's exactly why this document insists that segregation must happen immediately at the point of generation. A nurse giving an injection has to have that red sharps bin directly next to them, ensuring the needle is isolated the exact second it's done its job. Now for Section 5, Safe Destruction and Disposal.
So we've segregated and transported the waste, but there is a massive, massive difference between truly eliminating a biological threat and just converting it into a chemical one. When medical plastics, especially those containing PVC, are burned at low temperatures in open pits, they release highly toxic dioxins and furans right into the air. These are persistent organic pollutants. They bioaccumulate in the food chain and can cause severe immune and reproductive system damage.
That's exactly why Nepal's guidelines heavily prioritize these clever, non-burn technologies, which, by the way, respects international environmental treaties like the Stockholm Convention. Autoclaves use highly pressurized steam at around 270 degrees Fahrenheit to completely sterilize waste. Microwaves heat the moisture naturally present in the waste to destroy pathogens. And frictional heat systems physically shred the waste at high speeds while applying dry heat and steam, reducing the waste volume by up to 80% while rendering it completely harmless.
Finally, Section 6, our duty of care.
Okay, let's tie this all back to fundamental ethics, the duty of care and the polluter pays principle. This is the legal and ethical principle that if you create the waste while healing a patient, you are chained to that waste until you guarantee it won't harm anyone else. A hospital cannot simply hand over hazardous bags to a local municipality and wipe their hands clean of the problem. They are wholly responsible for ensuring the treatment facility actually neutralizes the threat.
And this is the really cool part. Proper healthcare waste management directly supports the UN's Sustainable Development Goals, good health, clean water, and climate action. So this local standard operating procedure in Nepal actually ripples outward, helping the entire globe fight climate change and protect our water sources. By following these rules, facilities actively prevent toxic runoff from poisoning local water supplies and drastically cut down on greenhouse gas emissions by abandoning open-pit burning.
So, what does this all mean for us? The blueprint for safety clearly exists, but the next time you visit a clinic or a hospital, take a look at the bins around you. Ask yourself, are they genuinely honoring this duty of care to the community, or are they just mixing the red and the blue hoping no one notices the hidden cost?